Here is my first application of the Capsulaser SLC with posterior polar cataract. As usual, I started with two paracenteses, and while entering the antechamber through the second paracentase, I fixed the globe while doing the 2.4 clear corneal incision, as we can see, then applying the HBMC over the cornea. Here is injecting the capsule blue into the anterior chamber to stain the anterior capsule. Slow injection. After 60 seconds, wash out the capsule blue. We can find a homogeneous staining of the anterior capsule. Then washing the HBMC over the cornea, filling the anterior chamber with OVD. Here is applying the Capsulaser circle over the anterior capsule and adjusting the focusing point to be slightly crossed. As you can see, while applying the Capsulaser, the patient moved his head and the rhexis was incomplete. My target was 5.5 millimeter capsular rhexis, so I choose to apply a second shot. You can see here in slow motion, the second shot complete the rhexis, and now I have a well-centered and circular capsular rhexis. As we can see, then using the capsular rhexis forceps to remove the anterior capsule disc, as we can see, and empty the antechamber slightly from the LVD before doing the hydrodelineation. It's very important in posterior polar cataract to avoid the hydrodissection because it's risky to open the posterior capsule. Just gentle hydrodelineation, then applying the HBMC, applying the viscoelastic into the antechamber, and very gentle emulsification with maintaining the antechamber stability while doing the emulsification of this soft cataract. As we can see here, also I choose the chopper to feed the tip of the phaco probe with the lens particle. As we can see here, just very gentle, feeding the tip of the phaco probe with the lens particle. One important step in posterior polar cataract, maintaining the stability of the anterior chamber, avoid any collapsing of the AC. So it's very important before take out the phaco probe from the anterior chamber to fill the anterior chamber with some viscoelastic to maintain the anterior chamber and prevent collapsing of the AC after removing the phaco probe. Here is the bimanual irrigation aspiration to clean up the cortex with a slow parameter, as we can see. Also, it's very important to maintain the anterior chamber very well stable and filled properly. Avoid any turbulence in the AC. It's a very important step while emulsifying any cataract in posterior polar type. Uh, then also before take the irrigation probe out and chamber, you can see I fill the capsular bag with some viscoelastic. Here is I change the bimanual irrigation aspiration to complete clean up of this cortex. Here is the last cortex piece. Also, I inject the viscoelastic to fill the capsule before take the irrigation probe out the anterior chamber as it's clear. Then I fill the anterior chamber and the capsule with the viscoelastic, and here is the implantation of the head of IOL inside the capsular bag. Actually, I was lucky that the rhexis was a 360 overlapping of the edge of the optic of the IOL. Then by manual irrigation aspiration, wash out the viscoelastic anterior and behind the IOL. And I choose to constrict the pupil in this case using the myocol before take the irrigation probe out the AC. Here is the myocol injection, and the pupil started to constrict. Also, I hydrate the paracenteses before take the irrigation probe out the anterior chamber. I checked this patient on the second day. Actually, the patient was very happy and the vision was improved from counting finger 0.5 meter into 2028 in next day with very clear cornea. And thank you for watching.